Now, Discovery Health has conducted a study on the efficacy of the COVID-19 vaccine since the outbreak of the Omicron variant in South Africa. Their data indicates that the two-dose Pfizer vaccine's protection against infection has dropped to 33%, but the protection against severe illness or hospitalisation remains high. It's at around 70%. Our business reporter, Kopano Gumbi, has the story.
More evidence is being released about the Omicron COVID-19 variant and the vaccines we currently have to protect against it. The variant, which is dominating South Africa's fourth wave, is highly infectious. But early signs that it's milder than the Delta provide some hope.
Thanks to and together with our colleagues from the Mediclinic Hospital Group and Intercare, a group of primary care facilities, we have gathered consensus anecdotal evidence from the healthcare professionals treating patients on the ground and in the hospitals, and there is a very clear nuanced difference in the clinical presentation of these Omicron cases. From an out-of-hospital perspective, all clinicians are reporting higher reinfections of previously positive cases, multiple breakthrough infections in the vaccinated cases, seems to present after a shorter incubation period of 3 to 4 days. It's described as a milder illness with recovery within about 3 days.
And this milder illness could be a positive sign that any further mutations will be less severe.
Just looking at the short incubation period and the short duration of illness, that's a good sign. It means that people are clearing the virus quicker. But it's also important to see how long people shed this virus for and whether any people with lowered immune responses harbor this virus for longer, which makes viral evolution more likely. So I think we have to keep looking to see how long people shed the virus for after they become infectious, to try and predict whether this is more susceptible to viral evolution.
There is a growing number of incidental infections being recorded in children admitted into hospital, meaning they were coming in for another procedure when it was routinely discovered that they tested positive. Early evidence from the NICD had already flagged a worrying number of children under the age of 5 being hospitalized from COVID.
In the Omicron period, you can see that just 3 weeks into this Omicron period in Discovery Health data, both cases and admissions in under 18-year-olds have exceeded this index point for the Delta wave. So the data seems to be indicating a more severe disease in children under the age of 18.
This first-of-its-kind study by Discovery opens the door to more research being done, not just on the Omicron variant, but on how the pandemic can be better managed. For now, the rollout of booster shots to increase efficacy and the non-pharmaceutical interventions like masks and social distancing should give the country a fighting chance at economic recovery. For Newzroom Afrika on Channel 405, I am Kopano Gumbi in Johannesburg.